Hi, I'm Dr. Joseph Armotrading. I'm a general surgeon and general robotic surgeon who currently works at HCA, Florida, Northside Hospital. Traditionally, a common procedure a patient have is a hernia repair, a groin hernia repair. In the past, you'd have to make a big incision in the groin. To do that, now we can do it with 3 tiny pinky-sized incisions. Patient is up running around the next day. An appendectomy is a common procedure we see in the emergency room. Again, a large incision up the abdomen or on the side of the abdomen. Now we can do that with 3 tiny incisions. Patient is home the next day. A gallbladder operation, again, required a large incision on the right side to take the gallbladder out. Now we can do that with 4 tiny incisions. Patient can be home in the same day. And that's certainly an advantage to the patient. With the robotic procedure, we use, instead of putting our hands in, we put instruments in that require only tiny incisions. And because of the robotic instruments also have wristed motions, they can just imitate my hand. So I'm still doing the procedure. I'm just using an instrument, an extension of my hand to do that procedure, if you will. At a personal level, I like to see a patient back who is doing so much better.